Hi, my name is Kayleigh. I'm 37 years old and I've been living with adenomyosis and fibroids. My health journey started when I was 14 years old. I'm 37 now, and I started off with having severe bad periods, vomiting, diarrhea, lots of extreme symptoms, having to be sent home from school. And I was always told that I would grow out of it, and still now haven't grown out of it. I've had two major surgeries, and it hasn't improved much at all. And I'm living with chronic illness every single month. Navigating my reproductive health has been really, really difficult. So I've encountered a lot of not being diagnosed, misdiagnosed, misunderstood, not believed. And I went undiagnosed for nearly 20 years. And also talking to like medical professionals, I get dismissed a lot. When I've been in hospital, there's been multiple issues where I've been ignored or symptoms have been missed, which could have been detrimental. So I've personally found the journey really, really hard. It's been long waiting for appointments and there hasn't really been a solution at the end of it all. What I feel is missing from the support and care services I've received personally is follow-ups. So you don't always get a follow-up. Sometimes you'll have a scan or an investigation and you don't hear back. Or there's been a few times where I've been in hospital and I've been told that my condition is urgent, I might need urgent surgery, and then they get told, actually you can wait. And then they'll say, oh, you need to be seen within the next 2 weeks. 6 months later, I've not heard anything from anyone. And that kind of just makes me withdraw and kind of suppress what I'm feeling. If I could design any interventions for the future, it would be more workshops and support groups about these conditions, particularly in the workplaces, so that there's a crossover with the NHS, your medical records and your workplaces, knowing about them. And also more support groups for women like myself, because before finding Cysters, I had no one to talk to. Of course, I've got friends, but if they haven't gone through the same thing as me, they don't always understand. They try to, but they can't always relate. They haven't been through it. And also the transferring of files like digitally, so it's easy to access and speeds up the process on what you need to help you. In terms of advocating for yourself, I would say don't be afraid to talk up sooner rather than later, because that's one step that I missed. And I kind of silenced myself a lot, so it's having the bravery to say what you need to say, what's really going on with you, and just being that real advocate for yourself, like what you're going through is valid and real.